Bristol Myers Squibb showcased Sprycel as the first-line agent in chronic myelogenous leukemia. The BMS representatives also discussed the possible side effects and their management. Sprycel is also used in imatinib refractory CML. Celgene shared data on lenalidomide in relapse refractory multiple myeloma as well as the survival benefit associated with post-transplant maintenance therapy. Celgene representatives also elaborated on improved survival data with Vidasa in high-risk MDS. Janssen-Cilag emphasized on improved outcomes with Velcade in multiple myeloma, especially in patients with renal insufficiency and chromosome 13 abnormality. Alexion representatives explained the role of chronic hemolysis in pathogenesis of paroxysmal nocturnal hemoglobinuria. The Alexion representatives also underlined the improved outcomes with Soliris in PNH. The delegates benefited from the close interaction with pharmaceutical representatives. The sponsors were able to share valuable data with the delegates as well. Binding Site emphasized on the use of free light chain assay in diagnosis of multiple myeloma and monitoring the response. This assay is especially useful in oligosecretory myeloma as well as amyloidosis. The assay is reliable and easily available and helps the physician in terms of stratifying their patients. The delegate benefited from these close interactions with pharmaceutical representatives and were able to get valuable information in an effortless fashion. The medal group is the main organizer of the BTG series and thanks all sponsors for their generous and continued support. The distinguished speakers and conference chairpersons were also available in the exhibit booth area during the coffee breaks and were able to interact with the delegates. BMS again shared data on Sprycel as first-line treatment for CML. Sanofi Oncology provided a platform for one-on-one interaction with Dr. Richard Champlin and the delegates. He discussed the role of Mozobil in stem cell mobilization as well as incorporation of anti-thymocyte globulin as part of preparative regimen for transplants. Novartis Oncology team discussed role of Tasigna as the first-line agent in CML as well as in imatinib refractory or intolerant patients. They also provided insight into the management of frequent side effects of Tasigna. The delegates appreciated such information. GlaxoSmithKline explained about the role of Revolade in relapse refractory chronic immune thrombocytopenic purpura. This was followed by a spotlight session on ITP. On behalf of the organizing committee, the MD Anderson Cancer Center and the University of Hong Kong thanks all sponsors for their continued support.